Today I'm going to be talking about cheek lift surgery. It is actually a surgery that is very effective when you have cheek descent or mid-face descent. And the area we're talking about is literally this area that's bounded by the lower lid coming into the upper cheek to the medial crease area. This can be either genetics, so in a younger patient who has some hollowness in the underneath of the eye area, a cheek lift can be effective, or also for someone older where it happens due to age. And what the cheek lift is really to enhance the lower lid. It does not, as sometimes people ask me, will it remove my smile line, improve my smile line? It really isn't for the smile line. It is really to enhance the lower lid. So when a cheek lift is done, the way I do it is I make an incision like you do for a blepharoplasty. That means an incision right underneath the lower lid, about 2 to 3 millimeters below the lower lid. Then what we do is we take our dissection deep such that we elevate the skin along with the fatty tissue underneath, along with the muscle underneath, and then release that all the way down into the mid-cheek area and lift it up and place permanent sutures and hike it to a higher spot. So what this does is it gives a nice contour to the lower lid cheek junction. So it gives you some smoothness to that area. And in both in the front view and a profile view, you'll notice that it has a nice OG or a nice S curve to the cheek instead of having a hollowness to the lid area and then the cheek area. With the surgery is done under anesthesia as usual. It takes about a couple of hours or so. Recovery is approximately 10 days or so. And usual precautions after surgery is to restrict activity for approximately 4 to 6 weeks, in the sense that no heavy, intense exercise or weightlifting or aerobic activity. It really gives you a very nice, smooth lower lid area. You need to come in for a consultation to see if you're a good candidate for this. People who are good candidates are people who are generally younger, and certainly even if it's a middle-aged person, someone who has nice, strong lower lid muscles. If you have any weakness in the muscle, that can happen in some people as they get older, then this is not the right surgery for you. So it's important for you to come in for a consultation so you can evaluate your lower eyelid area and see if you would be a candidate for this procedure.